Hello. This is Dr. Ahmed Al-Magable. Welcome to OET Professor course. In this video, we will talk about part B and what is the most common skills that you have to pass part B. First of all, you should know that you have to get in part B 4 or more out of 6. And we have talked in the previous videos when we talked about part B in listening. We say that part B in listening and part B in reading, they are very easy to get marks from them if you manage them, and if you let your mind absorb the skill. Okay, this is very super important. So you will be given part B and C insidiously, and you will be given 45 minutes. So in this text, in this subtest, as we said previously, you have to use the skill, which the time control skill. What is that? In the 45 minutes, you have to spend the first 15 minutes to complete part B. Then in the next 15 minutes, you have to complete part C1, and the last 15 minutes part C2. This is very super important. So doctor, you are given part B, which is just 6 questions. You given it 15 minutes, and you give the C1, which is or C2, which is 80 question, just 15 minutes. I will say the absolutely yes. And why is that? Because the questions of part B are very much harder and need more time than the question in C. Because the question in C, the answer themselves are very easy and very predictable to exclude. Okay, but we can manage part B because it's by using this skill. What skill that I'm talking about? Let's begin. In part B, there is different kind of questions and different types, such as that sometimes they are asking about a specific thing in the text. So, because as you said in part B in listening, part B in reading, each question is a whole kingdom by itself. Okay, each question is a whole kingdom by itself. So you have to treat each question with its own kingdom. You have to give each question in part B about 2.5 minutes, from 2 to 2.5 minutes, and in C 1 to 1.5 minutes. This is very super important. And as I said, there's very types of type B questions. Sometimes are asking about specific information in the text. Okay, and sometimes they are asking about the whole idea of the text. So you have to read the text very thoroughly, very deeply, so that you can understand each sentence which is talking about. You have to recap what I said, each sentence. What I mean by that: first of all, you have to read the question. Nursing staff can remove dressing if. Okay, so you have to read the question. Then you go to the text and read it thoroughly, just like this, starting from the title of the text. So dressing, post-operative dressing. Dressing are important components of post-operative wound management. Then I pause and I recap what I have learned from this sentence. Okay, in my own word, even if it's not in English or if it's not in Arabic, in your own word. Okay, so in the first sentence, he talked about that dressing is an important component. Okay, then any dressing applied during surgery have been done in a sterile condition and should ideally be left in place. Then I stop to absorb the info. Then I continue. as stipulated by the surgical team, then it's acceptable for initial dressing to be removed prematurely in order to have a wound reviewed, and in a certain situation apply new dressing. Okay, then I knew now when I have to remove it prematurely. This situation include when the dressing is no longer serving in its purpose. Then I read the example: dressing falling off, excessive exudate soaking through the dressing and resulting in suboptimal wound healing environment, or when wound complication is suspected. Okay, so eventually you have to recap and to understand each sentence by itself, and in the same time you have to put yourself instead of the writer. Okay, instead of the writer, so that you can understand where he is pointing off. Okay, so nurse on stand can remove dressing if a member of surgical team is present. No, they did not bring that out at all. There is a severe leakage from the wound. Okay, maybe they believe that the wound they believe that the wound has healed. Well, no, it's absolutely not. We have read it directly from here, resulting in suboptimal healing environment. You can read it: excessive exudate soaking through, right? So the most appropriate answer is B. And if we go to the other one, the second one, as explained in protocol, the position of RUM container will ideally, then I go and read it thoroughly. Unwanted medicine pharmacy collection protocol. Okay, then I read each sentence and I recap what I have learned from it. Okay, now I will give you 2 minutes, or you can pause the video to answer this question. Read the question, then the text, then you go back to the answers and read them and exclude what is inappropriate that the writer did not even point it to. You can begin now. Okay, so what is your prediction? What is your prediction for the answer? If your answer is encourage participant in the scheme, this is the correct answer. This is one type of type B question, okay, where the writer where the question is asking about what the writer is pointing to. Okay, what is the writer is pointing to. So this is very important. You have to read the scheme, you have to read the you have to read it very thoroughly, so that you can predict. Put yourself in the shoe of the writer of the text, what he's pointing to. He is pointing to encourage participation in the scheme itself. Okay, and you can then go to the third one, please. Now you can read the memo. The report mentioned the memo suggests that. So this is another question that is asking about the point of view of the point of view of the writer. So please just read it thoroughly. Okay, so what is your prediction? So if your prediction is A, which is the correct answer, data about patient error may be incomplete. Okay, data about patient's error may be incomplete, and they have pointed it right here. So that is the way that you can manage. But B, we will practice it more in the course session online, in the course online live session. So I want to make sure that each one of you will attend the online live session, so that we can practice on the recent test in the past 3 months.